All right, today we're putting on our detective hats. We're going to uncover the clues epidemiologists follow to track how an illness spreads, and more importantly, how they stop it dead in its tracks. So let's get right to the central mystery.
And this is a question that, you know, it feels more real now than ever, right? How does one sick person spiral into a global threat? Well, the answer gets at the very thing that makes infectious diseases just a completely different beast than any other medical problem.
Okay, this right here, this gets to the absolute heart of the problem. You see, in pretty much any other part of medicine, a patient is, well, a patient, a person who needs treatment. Simple. But with infectious diseases, every single patient is also a potential source, a risk to other people. The disease itself becomes the risk factor. It turns every sick person into a moving piece on a giant, complicated chessboard.
So to solve this massive puzzle, our first job is to figure out who all the key players are. You know, like drawing up a list of suspects in a classic detective story.
First up on our suspect list, the vector. A great way to think about this is like a living getaway driver for the pathogen. Now, don't get this confused with a non-living vehicle like a contaminated doorknob or something. A vector is a living creature. The classic example is a mosquito carrying malaria. And for some diseases, the vector is so essential that if you can get rid of it, boom, the disease is gone.
All right, next up is the reservoir. This is basically the pathogen's natural hideout. It's where it lives, it's where it multiplies, but here's the tricky part. The reservoir isn't always the thing that directly infects you. For instance, a cow's gut could be the reservoir for salmonella, but it's the contaminated burger from that cow that's the source that actually makes you sick. See the difference?
And that brings us to maybe the sneakiest suspect of all, the carrier. This is someone who's infected, they're contagious, but they don't even look sick. They might have no symptoms at all. These are the infamous silent spreaders, walking around keeping the disease going while no one has a clue.
And get this, not all carriers are created equal. You've got your convalescent carrier, who's still spreading germs even after they feel totally fine, but the one that gives public health officials nightmares? That's the early carrier. This is someone who's spreading the disease before they even have a single symptom. Just think about that. How do you even begin to control an outbreak when people are contagious before they even know they're sick? It's incredibly tough.
Okay, so we've got our list of suspects. But how do they all fit together? What's the master plan? For that, we need our next tool. It's called tracing the chain of infection. This is literally the step-by-step playbook a pathogen follows to jump from one person to the next.
Let's stick with our detective analogy. This chain is our crime scene map. It all starts with the culprit, the infectious agent itself. It's got a hideout, that's the reservoir. Then it needs an escape route, say a cough or a sneeze. It hops into a getaway vehicle, like the air. It finds a break-in point, like your nose or mouth, and bam, it reaches its final target, you, a susceptible host.
So the entire goal of public health, the whole game, is to break this chain. And you only have to break one link. Block the escape route with a mask, disrupt the getaway vehicle by washing your hands. But you know, one of the most powerful moves we have is to protect the target directly. That's what vaccination does. It's like giving the target an invincible suit of armor before the culprit even shows up.
So we can trace the path of the crime. But how do we measure just how big of a threat we're dealing with? How fast is this thing spreading? To answer that, disease detectives have one single super powerful number they rely on.
And that number is the famous R0, sometimes written as R0. So what is it? It's a measure of the raw, unfiltered infectiousness of a disease. Picture this. You drop one sick person into a community where absolutely no one is immune. The R0 is the average number of people that one person will infect. So, for something like the seasonal flu, R0 is about 1.3. For the original COVID-19 strain, it was estimated to be somewhere between 2 and 3. Now, the magic number, the line in the sand, is 1. If R is anything greater than 1, it means every sick person is infecting more than one new person. The outbreak isn't just growing, it's accelerating. It's growing exponentially. And that, my friends, is the birth of an epidemic.
What if R is exactly 1? Well, then each case just replaces itself. The disease doesn't explode, but it doesn't go away either. It just sort of hangs around. This is what we call an endemic disease. It's a constant, predictable part of life in that population.
And finally, this is the goal. This is what we're all fighting for. If we can push R to be less than 1, then each case fails to replace itself. The number of new infections starts to drop, and eventually the outbreak just fizzles out and disappears. Every single thing we do,
Washing hands, wearing masks, social distancing, it's all designed to get that R number below 1.
So what actually makes up this R0 number? Is it just random? Nope, it's math. It boils down to a simple formula. R0 equals P times C times D. And if we can understand what each of those letters means, we can figure out exactly how to fight back. Let's break it down. First up, we have P. That stands for the probability of transmission if you come into contact with a sick person. This is really all about the germ itself. How naturally contagious is it? So for an airborne virus, wearing a mask is a direct attack on P because you're physically blocking the particles from getting through.
Okay, next is C. This one's simple. It's the number of contacts a sick person has over a certain amount of time. This factor is all about us, our society, our behavior. How crowded are our cities? How many people do we see each day? So things like social distancing or isolation, they're designed specifically to hammer that C number down as low as it can possibly go.
And last but not least, we have D, the duration. How long is an infected person actually contagious and spreading the virus? We can shrink this window of time with things like rapid testing, so we find people sooner and with effective treatments that help their bodies fight off the infection faster.
So attacking P, C, and D, those are all fantastic tactics. They're the individual battles. But what's the ultimate strategy? What's the end game for winning the war? Well, it's a concept that's not just about protecting yourself, it's about protecting the entire community.
And that concept is called herd immunity. The best way to think about it is like a collective shield. When enough people in a population are immune, a virus that's trying to spread just keeps hitting brick walls. It can't find a new person to infect, so it has nowhere to go. It keeps running into dead ends.
And you can see exactly how it works right here. All those immune people, they form a protective firewall around the most vulnerable folks in our community. We're talking about newborn babies or people with weakened immune systems who can't get vaccinated themselves. The virus literally can't find a path to get to them. It's blocked.
So the big question is, how many people need to be immune for this to work? Well, let's take a really extreme example, measles. It's one of the most contagious diseases we know of, with an R0 that can be as high as 15. So to stop measles in its tracks, what percentage of the population do you think needs to be immune?
The answer is a whopping 94%. It's a staggering number. And it really shows you, the more contagious the disease, the stronger our collective shield has to be. It's just such a powerful reminder that getting vaccinated isn't only about you. It's about your contribution to building a firewall that protects every single person in your community, especially those who can't protect themselves.